Hello, this is Dr. Katsaros, and in this video I will be mainly talking about a traditional tummy tuck or abdominoplasty and how it can be optimized for best results and comfort. The case shown here is actually a mommy makeover where we performed a simultaneous breast augmentation and lift together with abdominoplasty and 3-zone liposuction. Body sculpting with J-plasma was not used in this case. An alternative to traditional abdominoplasty is Renuvion's J-plasma, as shown here. J-plasma is ideal for patients who are already thin and just have excess skin. The patient shown here is another good example of a Renuvion patient who had J-plasma because she is not overweight and mainly has excess skin. Notice that the J-plasma gives lasting results to 2 years or more. Recovery with J-plasma is 1 day, and you can return to work the next day. J-plasma is the best way of tightening loose skin without surgical excision. Liposuction or microliposuction alone will remove fat, but will not tighten skin significantly. This is why J-plasma is an outstanding way to tighten skin and contour the body after liposuction or excess skin. Although J-plasma is the best minimally invasive way to tighten the skin and subdermal tissue, it does not remove skin, and for this reason it is not ideal for patients that have C-section scars or excessive stretch marks. Notice that in this case shown here, the entire C-section scar as well as the tattoo were completely removed with abdominoplasty because everything from about 6 inches above the umbilicus to below the bikini line was removed with our abdominoplasty. Another thing to keep in mind is that J-plasma does not tighten loose fascia or muscle the way abdominoplasty does. The patient shown here is not overweight but would not be a good candidate for J-plasma because she has way too many stretch marks and her abdominal muscles are very saggy and loose. The patient shown here has 3 hernias and plenty of stretch marks. J-plasma will not be able to fix these hernias or remove the stretch marks. In addition, her loose abdominal muscles create the pouch seen here, and only a tummy tuck can tighten this muscle. J-plasma can't do this. By the way, in this patient, we also performed a breast augmentation procedure through her umbilicus, which is why she has no scars anywhere around the breast itself. Patients who have loose abdominal muscles and fascia will frequently have abdominal hernias. For these patients, we routinely perform preoperative ultrasound to look for ventral hernias. By the way, the Family and Medical Leave Act, or FMLA, will give patients 12 weeks of job-protected leave for hernia surgery repair, whether it's done during abdominoplasty or not. In fact, abdominoplasty is the procedure of choice for the repair of large abdominal hernias that cannot be repaired laparoscopically or with the use of mesh. And insurance companies will cover abdominoplasty repair of abdominal hernias. Check out the YouTube video link below, which shows how a patient with 70 pounds of overhang abdominal fat causing her chronic low back pain and who required a wheelchair before surgery was able to walk normally after removal of her pannus. The base abdominoplasty that is priced out by various cosmetic surgery groups only includes the price of the tummy tuck per se. It does not include the facility fee or hospital fees. In our facility, our fee for the base tummy tuck includes our facility fee because we do all our procedures in our own facility. You will not get a separate bill from a hospital or surgery center in our procedures. The base price of abdominoplasty does not include the anesthesia, the 3-zone liposuction, Exparel, or the tranexamic acids, which we recommend. These services are considered add-ons. We routinely recommend 3-zone liposuction for all our abdominoplasty patients to cover the upper abdomen, love handles, and flanks. The 3-zone liposuction is performed on the tissue that the tummy tuck leaves behind and helps contour that leaving behind tissue for optimal appearance. We recommend liposuction of the upper abdominal flap that is left behind after abdominoplasty so that this upper flap can be thinned out before connecting it to the tissue below the bikini line. If liposuction of the upper abdominal flap is not performed, there will be a step-off deformity at the bikini line, which is often seen in patients who opt for abdominoplasty without liposuction. Liposuction of the love handles and flanks helps create a contour. This contouring of the flanks and love handles gives the abdominoplasty an hourglass appearance, which is what we seek. We offer J-Plasma to all our abdominoplasty patients as an add-on, especially those who desire maximizing body contouring. To enhance the comfort of abdominoplasty, we recommend that all our patients choose to get injected with intraoperative Exparel, which reduces postoperative pain by 80 to 90%. Without intraoperative Exparel, patients complain of 8 out of 10 to 10 out of 10 level of pain after abdominoplasty, even when taking prescription narcotics. With intraoperative Exparel, patients have 1 out of 10 to 2 out of 10 postoperative pain for at least 7 days after surgery. We prescribe postoperative narcotics to all our post-surgical patients, whether they choose to have Exparel or not. However, patients who opt to have intraoperative Exparel injections use minimal postoperative narcotics, if at all. Using Exparel intraoperatively helps avoid the well-known side effects of narcotics such as nausea, vomiting, constipation, lethargy, slow return of GI function, and slower time to start eating normal food. Another medicine that we use with all our surgical procedures is tranexamic acid, or TXA. TXA reduces blood loss by over 80% and allows us to remove much larger volumes of tissue than if we had not been using tranexamic acid. Only 3% of plastic surgeons use tranexamic acid, which we feel limits the volume and tissue that can be removed in one sitting. When I was performing open heart surgery, I did pioneering work on tranexamic acid. So if you Google my name with tranexamic acid, you'll see the original study of 210 patients that I performed open heart surgery, and half of them got tranexamic acid, the other half did not, and that reduced postoperative blood loss after open heart surgery by 83%. So yes, we highly recommend Exparel and tranexamic acid for all our abdominoplasties. Like always, we offer free consultations for abdominoplasty or other procedures. Just text or call the phone number shown here. Thank you.